have my supplies. So what supplies do I need? I need a gown and gloves. I need a patient. What else? You need a consent. Very good. And what else? Before I touch the patient. Okay. Think about PPEs. I might need to make sure I have a mask. It's my hair covered. If you have sleeves on, I came in here like this for a reason because we really push covering up while we're on SJVC campus. And sometimes you're out there in the healthcare and you cannot put a gown and gloves on without bare arms. This is really important because I think it gets missed a lot. You should not have acrylic nails on. You should not have any type of nail polish on your hands. You should check the integrity of your skin. If you notice anything that doesn't look right, you want to point it out to someone. Is it okay if I scrub? I burned myself with a curling iron. Do you think it's okay I scrub my hands right now? That open wound can actually get transferred to SSI infection. So sterility is so important. You have to check your skin integrity. Okay, that looks good. I'm gonna go ahead and open my gown and gloves and start my sterile field.
No jewelry, no watches, no accessories.
Watches, jewelries, rings, they have to come off if you're going to be gowning and gloving, okay? That's the proper way. We're teaching you the gold standard, so don't ever drop below it. Now, for the gown and gloves, everybody struggles with this in the beginning because it comes in a package, so you take it out of that package and throw this one away. Next, you're going to need, you're going to need your gown and then the rest of your supplies. So it looks like I'm going to need a chest tube here, and I have some clamps. Did that other clamp come around that we're looking at? So envelope wrapper. The purpose of the envelope wrapper is I could either open it here and hand it to someone, or I set it on a surface and create a sterile field. Okay, so here's my gown. The first tab, and all this is in the explanation that we went through, there's a picture of opening a sterile field. The first tab, I like to kind of set it up closer to the edge so you have something that you're walking up to that's a little bit of a barrier. And you want to create some space that you can open things to. You don't want to cover up your gloves and put everything right on top of the same thing. So it's with a purpose. You check to make sure nothing's wet, there's no holes. Pull the tab towards you and back. This is the tricky part. Once we start rewrapping, these will start to slide around. Just put one little finger and then grab the other tab. Do not let the package control you. If it starts to flip up on one side, just reach around, fix your packaging so it doesn't slide. This is a brand new gown, so it's going to be a little bit different. Now, as you can see, part of my tab is kind of in the center right there. So if I just grab that, do you think that was okay to do? No. Okay. So we're going to take it back. I see a little ledge, so I'm actually going to pull it right here, then get to my tab. See these guys that are popping up? Control your package, and everything will be fine. So I have a little obstacle on this side I'm going to get to. All right, so I did a few things to see if anybody caught it. My hand touched right there. I visually saw it and know it happened. But if you're not sure and you think, I think I touched something, what are you gonna do? Even if you have to gown and glove 5 times that day. You don't want to ever open something and then knowingly contaminate it and keep using it. So that's not a perfect opening, but it'll get us started. So I want to open it to a space that I can get to. So I'm going to pick that side of my mayo stand. And then I just get my gloves. They're going to be sealed in a package for you. I see an obstacle. I'm going to work around it. Open your package. Start the edges. Make sure it doesn't go over the side. Present it to the field. Turn. Oh, so I failed, right?
Start over again.
Start over again. And I pointed it out. I'm going to start over. So I let my instructor know. Okay? You recognize there's failure. It happens. Start your edges. It would be better if I had the pill pack. I always say rewrap your pill packs and try not to do it this way. If you need extra pill packs, come see me. I can help you because this is difficult to pass a skill if it's already open. So you get your pill pack, pop it open. You might need to do a balancing act. Okay. Oh, happened again. Hang on guys, I'll fix it. I gotta get that seal on there better. See how frustrating it is? And imagine if you're gonna get a grade for this. Wonder what I'll get from you guys. Fail. Big time. Yes, question in the back, go ahead.
Because it might be difficult to do it in the air, are you able to do it on the table and then lift it up at the same time?
Do what on the table?
Like open it up on the table and move it.
To gown and glove, you're gonna want it. So my answer would be, what is the requirement from your instructor? Would be to get it on the field, because you have to know how to do this. All this takes is practice. If Trina ran and got a couple more of these, we do about one more and it's gonna go on the field because it was catching. Normally gloves do not come re-wrapped. That's why you will struggle with this pill pack, because they're pre-manufacturally packed in something that's gonna work when you open it. So that's the little bit of trouble you'll have. Gown and glove is up. What do I need to do next? Have my hat, mask. Okay, do I need to prep my patient first?
Yes.
Okay. What was that on the field, right? Is the prep on the field for the chest, or do I need to prep it now?
I will prep it now.
Okay. So my skin prep, I've already moved it out of the way. And then I also have to get an instrument up there. What, do you notice what I'm doing?
You're making sure you're not turning your back to it.
Because if I just walked over here and so I'm gonna go grab something, if I didn't turn my back to it, you don't know if your sleeve could hit the side of that. And it did, didn't it? Yeah, I believe it. So always, if you have to create a distance, when you walk around a sterile field, I tuck everything in, walk around it. Now I need to prep. So I select the correct prep, find the area that needs to be prepped. Do I work back and forth?
No.
Okay, so you're taught out and away, right? And be careful if you're prepping within the axilla, because that's considered like a dirty area anywhere in the axilla as well. I have to get a sterile instrument onto my field. Instruments should have an indicator. So if the hospital has a bowl, a medicine cup, something metal that they have in a pill pack, and they say, we want you to put that on the field. If you don't see an indicator showing that it's been sterilized, it's not sterile. And I'm gonna tell you right now, this package, everything in it looks good, but it hasn't been put through the sterilization process, so it's not heated up, and it's just packed. If you look at the indicator itself, it'll tell you, indicator turns dark when processed. Is this sterile? What color is that?
Oh, blue.
Is blue a dark color? Is that color dark?
I guess compared to what?
Yeah. So the only thing you're gonna see is either a light color or a dark, it could be a brown, it could be black, but it's gonna be darker than this color. And that's why I asked this question, because some people are like, well, what are you comparing it to? There's nothing on there. It needs to be darker than what you're seeing, and you'll also see the texture of the material looks like it's been cooked in an oven. Like if you were to cook muffins, the outside of that muffin feels like it's been in an oven. That's how packages feel, like they've been baked. So right now, just touching this, I know it's not sterile. So something to point out. Again, pill packed items, start your edges. Work. Sometimes you have to adjust your hand a little to pull the edge back. Present the item to the sterile field. And back. Now something I did here that it's a little bit more advanced, but if you can get the package to cover the back of your arm, when you open it to the field, it's covered your skin, so that doesn't go over the edge. My recommendation when you're opening gloves and whatnot, you get it balanced and open it to the field like that in an opening movement. Any questions from here? Did I miss anything? I just got to get gown and gloves. Avogard next. So you would find your Avogard, it's usually a couple pumps in your hand. Follow the manufacturer's instructions on the bottle. Dip your fingernails in the lotion. Get your hands nice and wet with the lotion. Work it down your arm. And then from here, if your hands are not dry, a lot of people spend a lot of time doing this. Woo! If your hands aren't dry, they don't go in the gloves. The arms don't really, they need to be dry, but this is what you need to have dry, your hands. So I went and got Avogard, wet, wet, wet. Wipe it down my arms. I created, wipe my hands. Do they feel dry? Yeah, they feel pretty dry. Uh-oh, I have an obstacle. What do I do with that towel?
A towel?
Yeah, it's in the way. You're gonna have a towel the first
It
time.
comes with a towel.
If you don't need it, everybody struggles with this, so I'm showing you now. You're gonna have a towel, you don't need it. You can pick it up and just hand it off. And then I put myself in a bad position. Next, you're gonna pick your gown up without dropping it, and you can only touch right here where the words are. You cannot, and I see this all the time, you cannot bring your hand to the side and pick it up. Was that okay?
No.
But, so, if I need to get my gown, I just pick it up. It's gonna flop around, I promise. Calm down. So, if you know how to fold these, it's not that bad. I can touch the inside right here. I cannot touch. So I wanna put it on me. Point the smiley face towards your mouth. Oh, it's smiling at me. Okay, so smile. And this is the part, all you do is, I've tucked my hand in the sleeve. Tucked my hand in the sleeve. I have control over the gown. It's not controlling me. I'm not like, ooh, it's gonna fall. Gown opens, open, and it just unfolds on its own. And I slide into it, go to my belly, because I'm sterile from where? So about this box area. And I just give myself, I have a belly ache right now because I don't have my gloves on and my nurse has to tie me up. So I don't want to move around. She's secured me, so I can go ahead and approach my field. Now, what can I not do?
Pull your hands out.
So I can't put my hands out like that. But can you straighten your gown below? Yeah, you can get kind of organized. Now my sleeves are puffy. So I have to recognize right here, self-check. How far can I move around things before I start touching stuff? Because my sleeves, so I know, and I'm short too, so I have to stand on my toes for stuff. Get my gloves, position the glove so you can access what's inside. You do not have to pop this open and spread it out, because the minute you do this, what are you doing? Okay, so all I need to do is get to my glove. This is the tricky part. Lobster claws, and you point the glove thumb to thumb. So there's the thumb of my glove here. Here's my thumb. I create my little claws right here. My hand is not coming outside of the cuff. It's right below the edge. I pinch the glove. On the other side, I have to pinch the other side of the glove. Okay, from here, this is the tricky part. Left hand comes up and over. The right hand, at the same time, you kind of have to tuck your thumb and push your right arm up. So, right hand, and this is the wiggle. I haven't let go yet. I'm wiggling my hand. Haven't let go yet. Okay, that's one hand. Now, can I adjust right here just like that?
No.
Big time. I see a lot of people just go right in and just start. You cannot adjust until your other glove is on. Okay, so this is a little awkward, but you have to get over it. Go in, grab my other glove, watch. I'm looking underneath my arm because I know my sleeve is going to get in the way. So I'm checking, step back away from the field, look around. Thumb to thumb. It's not perfect every time, but you can kind of line it up so it'll work for you. Grab this edge, lobster claw on the other. Right hand goes up and over. Left hand is just pushing. Up and over, tuck my thumb, push, push, push. Now my whole hand is stuck. Does that mean I failed?
No.
You have two gloves on, just adjust. It happens all the time. You adjust your glove. You want to get it up as high as possible on your sleeve. Gotta free that pinky up a little. So a couple things that happen. Number one, there's a lot of people in this room. My hands are sweaty. So that's what happens. If your hands are sweaty and they're wet, they kind of get caught up like that. You want to make sure you're as dry as possible. You can use the towel if you wet scrubbed. And then what do I have to do next? What's the last step here before I move forward to the finish? This is another tricky one. So I'll face you. Right hand hands the tie to the nurse. Okay? So I have to get to the tie, but I can't drop my hands like this. So sometimes if it's a little low, you can just kind of reach down and grab your string. Find your tag. Now, it's important that you don't just tear this apart. The one on the right side stays in the card. The one on the left side, you can usually just pull and it releases a string. Do not drop your left hand. You have to hold this string for a couple seconds. I hand the card to my nurse. This is my side of the card, that's her side. If she can't touch me and I can't touch her, hand her the card and I watch everything all the way around. Take my tag. You do have to switch your hand over so you can grab it, or you can reach around and grab. And just tie it from here. Go back to sterile mode. Okay? So you always have to remember, a lot of people will tie something and then they'll relax. You have to go right back here. And then from this place is where I would get to my sterile field. Take my instruments or whatever I need to use, and you would probably have your drapes and everything set up on your sterile field at that point. You could drape the patient off here and move, but can I touch this? No. That should have scared her. So you can't get into the mode. Once you're sterile, stay in the safety mode. Okay, any questions on gowning and gloving? Because I know you guys want to practice. Do I need to run through opening it all? Yes.
What happens if you accidentally drop one of your...
So I have my card, this one, and I'm getting ready to hand it to the nurse. Okay. So this happens a lot on the turning.
Here's your card.
So I get ready to hand this to the nurse, right? And the string, I'm scared, and then something happens. Oh, I dropped the string. What happens here? You just leave it? Or you could just drop it and let the nurse reach and she can tie it off for you. Okay? But it has to be tied behind your back. Behind your back. Just leave it there. It's totally fine. What are some other things that they would catch? No problem. Okay. So let me do one quick thing. I'll show you one last time how to open, because this is the part that everyone gets worked up over. You select your gown. It has to be folded perfectly. There's a video online how to fold your gown. If you don't fold it up the right way, you'll never pass your skill. It's very difficult.
It's on announcements.
So here is my field. Where do I do? Pull out and away, and I would not be in a gown doing this. Tab. Can I reach here and pull? No. So you just reach on the side the tab's coming from, pull towards you, and then find your item that you want to open to the sterile field. Open your item to the sterile field, and then get ready for the next move. But all it is practice. It's just over and over, practice, practice, practice. And refolding your
That elbow
gown.
move is so advanced. I can't do it.
Yeah, it takes time. It's too advanced.
I'm up.
Pop, yep, and step away. Yes.
So maybe for the teacher or instructor, what's like an autumn?
Can we show this real quick? What was that again?
So what's like a fail, or like how would the testing go? Or
So you should have a rubric, I believe, and I'm pretty sure that they'll give you an example. Is there like a skills checkoff that they'll be given?